Hi, I'm Hannah. I'm going to be doing your point and pressure therapy session today to start today's video, and I want to thank Luxome for sponsoring the session. We absolutely love their weighted blanket. We have the 15-pound in gray with a removable cover, and we love the removable cover because we have a 11-pound Chihuahua that sheds explosively twice a year, so it's absolutely perfect for us. So thank you again to Luxome. I'll link the product info in the description below, and we'll go ahead and start that session for you before I have my next client. So let's start by testing those anxiety levels right now, starting with your blood pressure. Do you have an arm preference? Okay, put that there. And I'm just going to get my stethoscope. Is that comfortable? Okay, you are going to feel just a little bit of pressure just to start this exam. Just breathe normally. Okay. So your pressure is a little bit high. Let's test those reflexes, see if everything's responding properly. So just go nice and loose for me. Good. Good. Okay. A little bit less on that other side. And perfect. So I do think you need a little bit of pressure and point stimulation today. So let's go ahead and start with the pressure. Close your eyes if you're more comfortable. And I'm just going to start pressing you. And just putting my hands, applying a bunch of pressure on your face, sides of your heads. Does that feel okay? I do a little point stimulation as well. You had a couple of weak reflexes, and just let me know if it hurts too much. Okay. The last thing I want to do is apply a bit of deep pressure touch stimulation, and that's going to be with that 15-pound blanket we discussed. So I'm just going to lay this over you. I know it can be pretty heavy. How does that feel? Super soft, yeah. It's very soft, very comfortable, and it should start feeling very calming and comforting. So I hope you enjoyed today's session. Thank you again to Luxome for making it possible. Go ahead and click that link in the description below to learn more. And I have to run to my next client, so I'm sorry I can't stay and chat, but I'll see you very soon. Hi, Jeremy.
Hi.
Welcome to your point and pressure therapy today. We're going to be applying some direct and more spread out overall pressure to the body. This has numerous benefits, increasing blood flow, encouraging healing, but also to help shape the muscles, tone, and stimulate sensation. Okay?
Sounds great.
Perfect. So before we begin, are you in any pain anywhere in your body? Anywhere you wouldn't want me applying a good amount, up to 15 to 20 pounds of cubic pressure?
Not really, no. I have a little bit of shoulder pain, but...
Okay, so we'll be tender in this area. If anything hurts, I want you to stop me right away.
Okay.
But otherwise, you'll be feeling anything from light touch to quite intense, heavy pressure, not only just by me, but with some tools as well. And is there anything that you want me to focus on today?
No.
Okay, great. So before we begin, I want to check your blood pressure. One of the things that this treatment can really help with is to slow down and create an even circulation of that blood flow. Do you have an arm preference?
Right on.
Great. Okay. And just relax your arm there. Is that too tight?
No.
Okay. And you're going to be feeling some tightness, some pressure in the arm, and should get you a little warmed up for today as well. Okay, blood pressure is just a little on the high side, so we'll retake that after the therapy and see if that helps.
Okay.
I also want to check all of your reflexes to see if those nerve reactions are working properly. We can focus on those as well in the therapy. So just up like this and relax my arm. Give me your full weight. Perfect. Okay. A little weak on that side. Nothing unusual, but might want to take a look at it. Okay. Same thing here. A little stronger on that side. Okay. There we go. So your right side's definitely less reactive than your left side, as your upper body. So we'll do a little bit of work there. If you're going to uncross your legs for me. Good. And on this side, the lower body, the right, is more reactive than the left. So we'll do the opposite treatment on that side. I'm going to test some other reflexes, but I'll just need you to lay back for me, please. Good. Okay, I'm going to bend your leg here and just, can you tilt your, perfect, just like that. Okay, same thing on this side, tilt that for me. Okay, that right side is good. Left side needs a little work. And I'm going to scrape the bottom of your foot. So can you up like this and just relax. Good. And this side. Good. I'm going to rub this along your belly just a few places. So yes, just arms to the side. I'm just looking for a reaction. Okay. I'm just going to be tapping around the face here just a little. So just close your eyes and let your jaw hang a little. Open your mouth just a little for me. Good. And just checking for any other reactions. To sensation. Definitely want to do a little bit of that point therapy. Some of the sensations, can you feel this on your face?
Yeah.
And here?
Yeah.
It feels the same?
Mm-hmm. It's
Good.
the same.
And does it feel really strong?
Yeah.
Okay, good. So we'll do a little bit of that point therapy, especially in the face, and that will help even out any sensation loss. It seems like it's pretty good, but we're just going to keep everything working, okay?
Mm-hmm.
All right, Jeremy, so I'm going to get started now. I'm going to move around to the other side of the table and we'll begin.
Sounds great.
So I think I'm going to begin with the point therapy for you. I want to create that stimulation first and then follow it up with the depression and the pressure of that. So I'm going to use a few different tools. We're going to start out with the most dull. As you can see here, it's going to be very light. I'll first get you used to my touch with my hands and then move to this. And then we'll slowly move through to a slightly more sharp edge, and then to a pronged edge, and then finally to a sharp edge. So starting first with just my hands, feel free to close your eyes. Just put these on the side there. Perfect. We want your body to be totally expecting the touch, expecting the movement, so that it doesn't react in a defensive way when we begin the therapy. At some points, the pressure and point therapy can get a little rough. So again, any discomfort, just shout out. The point is to shock the body, but also to ground the body. Okay. I'm going to move everything from your foot upwards towards the crown of your head for all the therapy. So I have this rounded tool, and I'm starting down at the bottom. I'll be holding in some places longer than others. It really depends on the tension I'm feeling in the foot and that pressure point that I'm trying to stimulate. Paying particular attention to the Achilles here. We did have that weak reflex. Moving upwards here. Focusing on the sciatica nerve, and that run down the entire leg. It's a little swelling in the knee joint, so I'm going to do some points here above. I'll be holding some points in the stomach area, the abdomen area. This is a little more sensitive. It's going to help with digestion, bloating, kidney function as well. I'm going to press a point between each rib. You said you were having some shoulder discomfort in this one, right?
Mm-hmm.
Okay. Gonna hold right here. Moving on to the face. And then some points in the head. We'll move on to a sharper tool. right, Jeremy, how was the first one? The dull?
Oh, good.
Okay. I'm going to move on to a slightly sharper one now. Again, just grab my attention if anything hurts.
Okay.
And we'll work back from the head and follow back down. Moving now to our pointed edge, the first pointed edge. This treatment is a bit of a cross between acupressure and acupuncture. It doesn't actually break the skin, but it has a similar effect of bringing blood flow and stimulation to the area. It's a good alternative if you don't like needles. Again, that side nerve. The ears are home to many different points. They can be quite intense because they do link to a lot of parts of the body. Moving on to the sharpest tool, the sharpest point we're going to use today. Just keep your eyes closed, try and control your breathing and relax. There may be some pain and discomfort with this tool. That is normal, and it is part of the treatment, but I'll try and make it as quick as possible. but I'll try and make it as comfortable as possible, okay? Trying to work on the scar tissue here. You can definitely feel it. All right. How are you feeling? Is anything still uncomfortable?
No.
Okay. I'm going to move on to doing a bit of pressure now, starting out with just my body weight, and then we'll use a weighted blanket as well. So by using my body weight, I'm forcing you to compress. I'm forcing your body to collapse in on itself. That allows the body introspection, to heal, to grow, and to fight back. I'm basically introducing a foreign outside body, and your body will fight back accordingly. With my hands, I'm able to apply about 30 pounds of pressure. We don't want to hold too long in any one spot. We don't want to cause injury. Okay. Now just slide your legs up for me for a moment. I'm going to be covering you with a Luxome weighted blanket. And put your legs back down. This blanket weighs about 15 pounds, and you can get them in different weights. We chose 15 for you today because we won't want it to be as much pressure as my hands, but it should be really soft and comfortable, and this cover is removable, so we wash it between clients. How does that feel?
Feels good.
And that should still continue that healing, that safety. It can help reduce anxiety, so definitely encourage getting one of these at home when you're not here and getting your session. I'm going to move on up. With those larger muscle groups, I've got to apply a little bit more pressure. Always careful to avoid the knee joints. Do not want to apply pressure to the knee joints. Take the pressure down to about 15 pounds. In the stomach area is a very sensitive area. Our main focus is to stimulate digestion and to try and get that any water or waste or toxins to move through the proper channels, through the intestines and out as waste. Lay your hands flat for me, please. Take a deep breath in. I'm going to apply the pressure as you breathe out. And as I release the pressure, fill your lungs again. And release. Squeezing the cranium. Do one final grounding. Are you comfortable?
Yeah.
All right, I'm going to add one final bit of pressure and weight, and then I want you to lay here for the next 15 minutes or so and really let the weighted blanket keep you down. You may fall asleep. Can definitely be helpful in just creating a safe, comfortable place for your body to relax and rest. And that little extra bit of pressure just really helps drag you into the earth, keep you completely still. Let me grab my last bit of pressure, okay? All right, so I'm just bringing in an additional about 11 pounds. I'm just going to place the 11 pounds in your leg area. Does that feel okay? Is it too much?
That's great.
Okay. All right, Jeremy. Well, you've got the 15-pound Luxome weighted blanket to keep you grounded, and then the additional 10-pound, 10.5-pound weight that I've placed in between your leg area. And this should keep you quite comfortable and stress-free and anxious-free for the rest of your session. So go ahead and lay here until you're ready to get up, and just give me a call if you need anything.
Sounds good. Thank you.
Thank you.